Ryan Hetland here. Wanted to do a quick video on simple rehab tips for you, basically to teach you how to do a plank and kind of my top 3 core exercise moves, and I wanted to give you a couple reasons why we do that. For the biggest reason, when someone comes in with pain or you have a musculoskeletal problem, there's 3 things we want to restore, and one of them is mobility, and that's really the first one. Mobility, alignment, and then stability. So the last thing we want to get to when we're rehabbing a patient and getting them to self-sufficiency after an injury is stability. And how we do that is we start with giving people relief by our treatments and our care, and as people get relief, then we move into the second phase, which is repair, and where we start giving them stability exercises. So we don't want to do exercises when we're in a lot of pain musculoskeletally. We want to start moving a little bit. We want to walk. We want to do things that are like stretches to, not past movements. So we'll do things in the office where we do wobble chair therapy, different things that are more passive and not very active. As soon as relief starts, we'll start giving people static exercises to start engaging the core. And here's the key thing to know about the core. It doesn't move anything. The core doesn't move certain parts of the body like your bicep would, or your legs would, or when you do a crunch, it's moving your body. The core is an anti-rotator. It's to tighten the spinal column so it doesn't actually move. It stops it from moving. So the best, most safest one to do is a side plank, and I'll show you here quickly how to do that. There's a few variations on how you do it. When you're starting off, you want to start off the easy way. You're going to start off just kind of bending your knees, putting your knees together. Not your feet though, you want your feet separated. You want your elbow just under your shoulder, and you're going to bring your hips into alignment with your nose and your belly button, and so you're down on the knees, and everything is in alignment here. This is the easiest way to do it, so there's pressure on your knees, pressure on your elbow, this is all tightened. This is tightened up here, and you're stopping the movement. You might want to start with 20 seconds, 30 seconds of this. You should be able to get to where you can hold this for 60 seconds without shaking. If you're shaking, that means you're weak and you need to, work your way up to building up to it. So once you can hold this side for 60 seconds, and you can flip over and do the other side, which I'll show you here. You just get the knees together, feet separated like this, arm under there, and you tighten things up. So once you can do that for 60 seconds or more, you can move on to going to the feet and holding it this way. You should be able to hold this for 60 seconds before you move to the next phase, but you should be able to hold it this way. Now this might take you a while to get to that point to hold that without shaking. The third variation is up on the hand itself rather than the elbow and on the feet, and holding it here. This is a static move. There is a fourth variation where you can start to add movement into it, but you don't really want to get to that point in this phase of the progression. It's really important to know how, when to do these exercises. So if you don't have a doctor prescribing this for you, I would be cautious depending on the severity of your injury. Now, if you're just trying to engage core and get work on it and maintain stability, then these are a great place for you to start. The original plank is from the front, where you can start on your knees, which makes it easier, and you're tightening up your core here. Or you can go to your toes, which is the second variation, or you can go on your hands like this, and you're just holding that for as long as you can without shaking. There's the third one, this will probably be the last one I show you, is a bird dog. And I'm no expert at this one, but basically you're going to get on your hands and knees, and you're going to bring this arm out and the opposite leg, and you're going to hold everything in alignment just like you would a plank. So instead of planking like this, you'll be on your hands and knees. You'll bring the leg out, and you can bring it in, bring it out. Now that's adding some movement in here, so you want to make sure you're ready for this. And then you do the opposite, holding it out, bringing it in. There's other exercises to do, like the reverse step lunge, the crunches, and a bridge. So these are all fairly safe exercises for you to start doing. Of course, ask your doctor if these are right for you at the moment and if you should be doing these. The third phase, when we're rehabbing, we're adding more exercises that are less stability and we're more moving our body. So I hope this helps you. Just remember, things like golf, bending over to pick up a pencil, the key is you don't want your vertebra sliding around sloppily with no stability, with no core, because then what happens? All of a sudden your back goes out doing the simplest of moves. So we're trying to prevent that by engaging the core, which does what? Stops the movement and tightens up the spinal column so it's not moving around and risking a disc herniation or bulge or re-injuring that part of your body. So Dr. Ryan Hetland here with River Heights Health and Injury Clinic. I hope that helps you and is a good resource for you to learn how to do these exercises.